I'm Jovan Perry, and I work as the Economic Assistance and Employment Supports Division Director for the Department of Human Services, formerly, and now the Department of Children, Youth, and Families. I am a champion director for Whole Family Systems and support the governance team. Black maternal health is not only a Minnesota issue, but also a national issue. According to the Center for Disease Control, compared to white women, Black women are 3 times more likely to die from a pregnancy-related cause and experience maternal morbidity. They also experience mistreatment by healthcare providers at a higher rate, and infants born to Black women are twice as likely to die, with 60% of those deaths being determined as preventable.
A community-based program by NorthPoint Healthcare aims to reduce Black maternal health disparities with opt-out doula services and comprehensive integrated services from community health workers.
I was depressed as well. I was homeless. My doctor just was like, I think this will be good for you, African-American women, in the community. I just think it will be a good experience for you. So I just did it, and I'm just glad that I did. I honestly did not want to do the group, but I felt like I'll come and step out my comfort zone, and I'm glad that I did that, and I was able to be myself, and then we just became like a family. We became sisters. It was real good. It was a smooth pregnancy, and I was glad that Rakisha and them recommended me to her.
I am in charge of designing, implementing, and monitoring the Whole Family Systems prototype, which we have to ensure holistic healthcare for Black birthing people in North Minneapolis.
We really designed it to really focus on our community, and so we utilize individuals who look like the people we serve. So our community health workers play a big role.
As a senior community health worker here at NorthPoint Health Wellness Center, I do education with them. I do groups once a month, and also one-on-one case management.
The program at NorthPoint Health and Wellness Center has been successful in connecting health and social resources with the support of community doulas.
Working in and with the community, NorthPoint has the trust of the community. And through this work, improved access to doulas and community health workers. We were impressed by their results, to say the least. Given the national and state data, NorthPoint reports that 100% of the mothers who participated in the Whole Family Systems Initiative experienced full-term births.
Whole Family Systems doesn't aim just to address the symptoms of disparities. It aims to address the root causes of those disparities, which is a really interesting and unique opportunity for NorthPoint to be able to collaborate with DHS and build in order to make that happen, as well as with our community and other staff members. So as part of that, it not only focuses on making sure our prototype is successful, but what systemic changes need to happen to make sure that programs like this are sustainable and able to happen across the country.
Jonelle she was the best, and I just like that. Even though we did a group once a month, we also got to meet with her one-on-one.
It was really about bringing all the things that bring people joy in the birthing process to the table, and not just focus on the disparity that was happening.
Working with her has been probably the best thing that I've ever done. I deal with depression and anxiety, and with that, before this pregnancy, I had a miscarriage with twins, and I went to find out what I was having, and they didn't have heartbeats. So this pregnancy was so scary for me. I couldn't have got through it without Jonelle, and she's the first person I ever told that to about the miscarriage, because that's something I didn't want to talk about. And I'm glad that I did, because she got me into therapy. That was the first time I ever went to therapy, and I would have never did it if I wouldn't have had that conversation with her.
It's different because I had more support. I had more access to things that I didn't have access to before. I had case management that I didn't have access to. I had access to different like events with around different mothers.
She helped with teaching me about postpartum and what I can and cannot eat while I was pregnant, and about breastfeeding, and it was a lot.
NorthPoint is unique in that we have human services and healthcare all on one campus.
The groups are not only to prepare our mothers and birthing people to become parents and to continue to be parents, but the people in their lives, their families. It is whole family system. So while it focuses on the whole person, that includes the people around them.
So using this whole family systems approach, having their needs addressed, receiving health care and human services in a manner that values their value system, that honors them as a person, that honors their entire family.
I was constantly checking in with them. I was constantly seeing what goals or individual plans that I can assist with. So I made sure that I gave them the resources that they needed, and I also referred them out if need be.
Community health workers are an essential bridge between communities and the healthcare system. They are an essential component in building trust between communities and the healthcare system, where a lot of trust is broken, and they're able to make sure that people are able not only to get medically sound care, but culturally responsive care.
I think it just was good to have another African American woman that we could go to, that we could be able to talk to.
She just like a mom, like she just love, like, and she don't judge, and she just support.
The program has become an ally for Black women and a model to follow statewide.
NorthPoint has ideas for specific program, policy, and practice changes. For example, we need to create a pathway for community health workers to be reimbursed by Medicaid for maternal health services and human services and non-medical settings for activities such as enhanced prenatal care classes and telehealth.
I think Minnesota continues to be on an evolution for maternal care coverage and what we cover for birthing people. But specifically, I would say that our kind of relationship with whole family systems has really shown us that there are other areas we can improve on right now.
And so it was very important to us to ensure that we took the time to really talk to the community that was being impacted, Black women, find out what they needed and wanted to see. And we had the opportunity to work with the state to develop this prototype.
Black women are seen as integral members of their family, integral members of their community, and being able to support their whole person, their family, their network is crucial, just very important in helping them experience wellness, in helping them to reduce stress levels that really impact health outcomes and birth outcomes.
Healthy Black pregnancies are the beginning of healthy Black families.